Joining us for more is the President, Association of Resident Doctors in Lasuf, Dr. Owaku Itohan. Good to have you join us. Now, we know that you have now commenced your industrial action, but the Minister of Labour and Employment, Dr. Chris Ngige, said that a conciliatory meeting is being reconvened with the health workers. Now, he's asking NAT to respect the country's laws and suspend your industrial strike. How would you respond to that?
Well, it would be nice if we have everybody working together and we are on the same playing field. It's not just enough to say call up the industrial actions. We need to know you are sincere. Yes, you've met a few of the demands, but there still smacks of so much insincerity, and we feel we need to go back to the drawing board, yes, but it's not enough to just call up. Let's know that you will do what you have promised to do.
So like you also noted, he said 6 demands have been addressed, but out of the 8 demands. So talk to us about what has been addressed and what is left.
Okay, what has been addressed essentially from federal tertiary health institutions include the reinstating of sacked doctors, that those in Jos University Teaching Hospital, also provision of personal protection equipment in some of the hospitals that were involved in non-availability of such. Also, we've had payment for 2 months of the COVID-19 hazard inducement allowance out of 6 months that was promised, and a few others. But I would say, like I said, there's federal tertiary institution and then the state tertiary institution, which is actually a major issue because we have several state tertiary institutions all over Nigeria and with varying issues. And we find that for us, the implementation, domestication and implementation of the Medical Residency Training Act, even including that of federal institutions, is yet to be achieved. So that is pending. It's a major thing. It's an act that governs the tertiary institutions all over Nigeria, teaching tertiary institutions all over Nigeria, and that is still pending. We also have, for us, exactly here in Lagos, we have issues such as the salary disparity, which also cuts across other state tertiary institutions and some federal institutions. There's this great disparity between what we take home and what
just allow me jump in quickly, Dr. Itohan, because he said that a conciliatory meeting is ongoing. Is that true? Are you open to dialogue? And when are we going to see this industrial action come to an end?
Okay, well, there was some sort of silence in this supposed reconciliatory meeting, but I'm aware that they've scheduled another meeting for tomorrow, that's Wednesday. So we hope that the meeting will be a fruitful one. But for us down here in Lagos, for demands such as the COVID-19 hazard inducement, we are yet to get any tangible meeting as such. We've been meeting on salary disparity. There's a committee that was set up by the Lagos state government, and we've had series of meetings with them. That seems to be moving. However, it's so slow, and we are not even sure we're positive. We don't know where we are heading to on that ground. But for COVID, there is no meeting whatsoever. We do not know what is being done. We were told by the Ministry of Staff and Training that they needed to compile the list of those that were infected in the Lagos State hospitals, and we are on that. So really, a lot of shifting of goalposts in the last few weeks to months. Like I told some other of the press that we've been on this matter now for 3 months, and I think if we were going somewhere, we should know where we are, and we should be able to be on the same playing level field.
We do have to leave it there. We will see how things pan out in the coming days. Dr. Owaku Itohan, thanks for talking to us.